live here at the Urinary Olympics. I'm your host, Mac Young.
And I'm Sam Hatfield. Our other partner, Blade Matthews, is running just a little bit behind today.
Starting off with the urinary system, we're going to talk about.
Sorry guys, I'm late.
Are you for real? Is this happening now?
Second day in a row.
This late.
Kids, they kill you. Alright, where were we?
We were at the urinary system with the two kidneys.
Alright, the function of the two kidneys is to remove liquid waste from the blood in the form of urine.
There's a couple diseases in the kidneys. One is kidney stone disease, which are small, hard mineral deposits that form inside your kidneys. It's caused when your urine contains more calcium, oxalate, and uric acid than your fluid in your urine can dilate. To prevent it, you can drink plenty of water. Another disease is polycystic kidney disease, which is a genetic disorder in which abnormal cysts develop in the kidneys, which is caused by abnormal genes and genetic mutations. To prevent it, reduce salt and use a diet low in fat.
Wow, that is a lot, Sam. So next up, we've got the two ureters, and Blake, why don't you tell us a little bit about those?
Alright, well, first off, the function of the ureters is to carry urine from the kidneys to the bladder. That's all I got.
Okay.
There's one disease for the ureter, and it's called urinary incontinence, which is the involuntary leakage of urine. It's caused by underlying medical and or physical conditions, and it can be prevented by maintaining a healthy weight, avoiding caffeine, and acidic foods.
All right, so we got kidneys, ureters, bladder's next. All right, Blade, tell us a little about the bladder.
Again, the bladder's function is the contract.
Okay, yeah.
Alright. The bladder's function is to contract and flatten to empty urine through the urethra.
One disease of the bladder is interstitial cystitis, which is the chronic inflammatory condition of the submucosal and muscular layers of the bladder. Yeah, it can be caused by damage of the bladder lining and bacterial infection. You can prevent this by drinking cranberry juice and balancing your hormones.
Good stuff, Sam. Moving on, we're going to talk about the two sphincter muscles in the urinary system.
Alright, the function of them is to help keep one urine from leaking by closing tightly like a rubber band around the opening of the bladder.
Okay.
Well, the disease of the sphincter muscles is benign prostatic hyperplasia, or BPH, which is enlarged prostate gland. It's caused by changes in hormone balance and cell growth factors. BPH, or the urinary problems it causes, really can't be prevented, but some believe regular ejaculations can help.
What?
What, Sam?
That's what the research said.
Wow. Who would know? Who would know?
Crazy.
Ejaculation. All right. Nerves in the bladder. Tell us a little about them, Blake.
Alright, well, the nerve's function is to alert a person when it's time to urinate or empty the bladder.
There are no known diseases for nerves in the bladder.
That's kind of odd.
All right, Sam. Well, rounding out our list is the urethra.
Alright, well, the urethra's function is to allow urine to pass outside the body.
There is one disease for the urethra, and that is the urinary tract infection, which is an infection that travels up the urethra to the bladder. It can be caused by E. coli and prevented by drinking plenty of water and cranberry juice. Guess that about does it for today.
That does it?
That does it.
All right, that's it.
I'm Sam Hatfield.
I'm Blade Matthews.
And I'm Mac Young. And that's it. That's all we got today. See y'all.
Get ya!